A 43-year-old self-identified South Asian woman presents to the primary care physician for routine health maintenance. She's scheduled to undergo an invasive dental extraction involving manipulation of the gingival tissues and periapical region of her teeth next week. Her past medical history is significant for non-ischemic cardiomyopathy that progressed to end-stage heart failure, for which she underwent an uncomplicated orthotopic heart transplantation 3 years ago. She's been clinically stable since the transplantation, but was recently diagnosed with mild asymptomatic chronic valvular regurgitation of the allograft mitral valve on a routine surveillance echo. All right, so it's important to note here. We have a patient that is likely going to some kind of dental procedure, and there's this evidence of some kind of valvular abnormality. And so I'm going to go ahead and highlight that. And so we can continue reading on here. She has no history of previous infective endocarditis. She has no fevers, chills, progressive dyspnea, or chest pain. She has no history of previous infective endocarditis, surgical valve replacements, or congenital heart disease defects. On physical exam, her temperature is 98.1, heart rate 78, respiratory rates 14, blood pressure is 122/76. Examination of the oral cavity shows poor dentition with significant dental caries on the right lower molars with no active fluctuant swelling or drainage. Cardiopulmonary auscultation demonstrates a normal rhythm with a soft grade 2 holosystolic murmur, best heard at the apex or radiates to the axilla. Breath sounds are completely clear bilaterally. There's no lower extremity pitting edema, and the remainder of the exam is unremarkable. Which of the following is the most appropriate pharmacotherapy at this time? So the big question here, and this is one of those very high-yield topics, is in a patient that's undergoing a dental procedure, do they or do they not require antibiotics? And so the big thing here to remember is that there's increased risk for infective endocarditis for a specific group of patients, and I have them listed here, and I'm just going to read them out. So patients who have a prosthetic valve, so somebody who had an aortic valve change, mitral valve change, any kind of tricuspid valve, any of the valves, if there was any kind of intervention done to put a prosthetic valve in, they need some kind of a prophylaxis, and I'll get into exactly what the options are for prophylaxis, because some of these are distractor options. So prosthetic valves, any prior history of infective endocarditis. So in this patient, we saw that they've never had infective endocarditis, but if even there was a remote history in the past where there was some kind of a bloodstream infection that led to infective endocarditis, those patients need to be on some kind of a prophylactic antibiotic before their dental procedure. The other one is a congenital heart disease. So if you think of any of those cyanotic heart diseases or just any kind of ASD, VSD, any condition that they were born with and that led to some kind of a cardiac defect that was either repaired or not repaired, those patients will need it. And then lastly, any patient that was has undergone a cardiac transplant that was complicated by valvulopathy. So that is our patient here. She had a heart transplant. Now she has a mitral valve that seems to be having some kind of a regurgitation that's evidenced on the echo as well as on physical exam. So prior history of prosthetic valve, prior history of infective endocarditis, congenital heart disease, and a cardiac transplant complicated by valvulopathy. All these people need infective endocarditis prophylaxis prior to a dental procedure. Now, what are your options? So your first line option is going to be amoxicillin. The only time amoxicillin is not the answer is if they're allergic to it. So if they're allergic, you use the macrolides. So specifically, clarithromycin is a good example that you can use if they're allergic to amoxicillin. And the whole thing you're trying to cover for is gram-positives. That's why both of those are appropriate options. And so there's no point discussing any of these because we know this patient has the indication for it, and the appropriate antibiotic for this is going to be amoxicillin. So for those reasons, A is the correct answer, and this is incredibly high yield, so just remember to go through those specific high yield populations that I listed out.